Hey y'all. Y'all have to forgive my appearance because I wasn't going to do video today. However, two things. Um, those of you who've been following me for years, thank you so much. You mean the world to me. I never take you for granted. Never take you for granted. Okay? Nobody owes me anything. I'm not a narcissist where I think the world owes me just because I breathe. Okay? And number two, somebody had sent me a really nice message the other day. And I want to tell you that that means a lot to me. And I'm the person you want to talk to in regards to chronic pain because I have chronic pain every single day. And I appreciate you and your comment. And everybody viewing this, I appreciate you as well. All right, so let's have a come to Jesus meeting. All right. All right. So, what I didn't tell you about my doctor visit the other day is that he made me wait for an hour before I could see him. Half an hour to 45 minutes-ish is about the norm, waiting for a doctor, okay? He made me wait for an hour. His nurse was a snotty bitch. We're just gonna keep it raw today. If you need fluff and BS, you came to the wrong freaking channel. Okay? Because we keep it raw over here. She was a snotty bitch. There was no warmth at all. This was at University of Missouri Hospital. No, excuse me. Missouri Orthopedic Institute. His name is Dr. Moore, Moore, and I don't give a rat's ass. His nurse is a bitch, and he's an ass. And we'll talk all about that. She was very to the point. What's your name? What's your date of birth? I'm not used to that. You guys know I've had tons of surgeries with them. I mean, they probably know me on a first name basis over there, okay? All right. So this isn't the norm. I'm well versed on how people treat patients, how they treated me in the past. I only had one incident with one doctor. We're not going to go there. But I got rid of him. I fired him, and I made it clear with my real doctor that I had after him that I don't care whatever. I don't care if I break every bone in my body. He is never to touch me again. And he was stunned by what I told him. He was totally stunned. You don't let a patient wake up without anesthesia from surgery. You don't do that. But when you're a narcissist, that's exactly what you do. Anyway, so the nurse was a snotty bitch, and they made me wait for an hour. And then when I asked the giggling nurses and whoever the hell else they are, I asked them, I said, do you know when he's going to be ready? And she said, well, he's got another patient ahead of you. No warmth, no smile. No, I'm sorry for the wait. We're real busy today. No professionalism at all. She was a snotty fucking bitch. And I don't really care. I'm not the person you want to treat like crap because I would tell the whole world. It's just that simple. You know how you avoid that? You act like a professional. You don't act like you're shocked because your patient has brown skin, which that could be the real issue. I don't know. All right. We are in Missouri. I don't expect people to act that way because of my skin color. I give everybody a clean slate. But when you're that much of a horse's ass, and I didn't do nothing to you, and I didn't give you the slap that you deserved a long time ago, what are you tripping for? Anyway, so she was a snot. And then he came in and he didn't apologize for being late. He was cold. He would not look at me when he would ask me questions. He would continually cut me off while I was talking. He did do a physical exam on me for my strength in my body. But I have bone on bone in my neck, and he up here telling me that he wasn't going to do surgery. And this is prior to him looking at a MRI. I got a piece of hair. There we go. This is how you gonna make that kind of decision before you look at an MRI? Number one. Number two, if you had bone on bone, Dr. Moore, how would you feel? Let me calm down. So he kept cutting me off, and he was like, warm, cold, warm, cold, warm, cold, warm, cold. He hit my foot when I had told him, not on purpose, but he bumped it. And I said, ow, I had surgery on that foot. He's like, oh, I'm sorry. And then he'd be back to being cold again. And this was like a bipolar thing. The whole goddamn visit with him was just... So anyway, I said, well, can I get a soft collar so that when I'm doing something that's straight in my neck, I can use it so my neck has something to rest on. And they got me a soft collar. And then he was just a total ass, disconnected from me completely, acted like he really didn't want to be there. I bet you don't have a problem getting your check, though. You don't have a problem getting paid. And then when we were leaving, I said, thanks, Doc. Like, okay. And he said, good luck with that collar. Yeah, good luck with you. Fuck off, motherfucker. All right, okay. All right, let me calm myself down. I have never treated a patient like that. I've had patients, I used to work in OB, I worked in the ER, and I also worked in the med-surg unit, which is, for those who don't know, it's a medical surgical unit. And I have never treated a patient like shit. Never, 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 never. I've had OB patients who were crying because they were scared because they had to have a C-section. I held their hand. I talked to them the whole time because I know how scared I get when I'm a patient. So I'm not going to let you feel like you're alone. I freak out every time, especially before surgery. And I've had a lot of surgeries and I still, okay? Thank God for medicines because that karate kicks all your fear, anxiety, karate kicks it and gets it right out of there, okay? Never, ever, ever treated a patient like that. I've had OB patients where I would run into them in the store in the town I used to live in, and their kid is not a baby anymore, obviously 3, 4 years old, whatever. And they're like, I remember you. Thank you so much. And I'm not tooting my own horn. This is from my patients telling me. I remember when I was in labor and you were there for me. I really appreciate it. Okay? You don't treat patients like crap. You just don't. And if you're acting like you'd rather be at a funeral, then get out of here. Okay? Get out. With that being said, before I go into my other part of my tirade, with that being said, almost all, okay, I might as well say it. All my doctors are wonderful because I'm not going to keep you if you're not the only doctor in the world. And I'm not impressed with you being a doctor because guess what? You put your motherfucking pants on the same way I put my goddamn pants on. I'm trying to calm down, but it's just pissing me off that somebody could be in a vulnerable position and someone else who's supposedly their doctor treats them like they are the scum of the earth. How dare you? So, I put a nasty review on Yelp and I don't really give a rat's ass who likes it, who don't like it, who hates it. I really don't care. It has no effect on me at all. So, this is what I wrote on Yelp because I want the whole world to know. And I want, you know what I'm going to do since you're so into yourself and I destroyed your life by making an appointment with you? I'm going to help you reduce your patience. I'm going to make sure people don't want to go to you. I'll karate kick you in your money because that's the most important thing to you anyway. So I'll karate kick you in your money. I'm good at that. I saw Dr. Moore recently. This is what I put on Yelp. He made me wait an entire hour before I could see him. He also didn't apologize when he finally walked in. He's rude, cut me off several times when I was speaking, and when I had another question about my x-ray, he said, I just told you that. I don't care what he just told me. If I need something clarified, then he needs to clarify without an attitude. He also informed me that he wouldn't be doing surgery on me despite me having bone on bone in my cervical area, which is my neck. This is before looking at an MRI. The absolute nerve of some people. There was no eye contact, and he basically acted like I ruined his day by being there. His nurse, or whoever she is, isn't that friendly either. I didn't appreciate her snotty attitude. I was a medical professional myself, and I would never treat a patient the way I was treated. They don't have to worry about me anymore. I will see a different doctor in reference to my issue. These so-called doctors forget that we hire them to provide a decent service. Goes to show you can be educated but still lack social skills and common sense. The nerve, the audacity. And I started to leave. When I looked at it was like 35 minutes, 45 minutes, 50 minutes. And I'm thinking, okay, maybe I need to reschedule. In retrospect, maybe I should have left and then, seen a different doctor. I don't know. But I am going to see another doctor. I put in a referral with my doctor. I requested a referral. So my point is this, okay? I don't care if you saw this doctor once or 50 times. If they don't have respect for you, you ditch them. It's just like you meeting somebody, a guy or a chickie, a girly, and either one of them has a major attitude or they got their nose up in the air when you meet them, you get rid of them because what you see is what you're gonna get. Okay? What you see is what you're gonna get. You don't have to put up with that crap. They put their pants on the same way you put your damn pants on. They wake up with funky breath in the morning and still have to brush their damn teeth. Okay? They are not perfect. They don't wake up with minty fresh breath and they don't have to use deodorant because they smell fresh 24 hours a day. Bullshit and triple layers of bullshit. Okay? You're educated. So what? You got more education than a lot of people. So the hell what? That doesn't make you a good person. It makes you educated. It doesn't mean you have common sense. It doesn't mean you have respect for people. It doesn't mean that you're not a racist ass. It just means you have education. That's all. Okay? Now, like I said, all my doctors are wonderful. My primary care is the cream of the crop. I adore him. He's sweet. He respects me as a previous medical professional, so he uses verbiage that I know what it means. He has respect for the fact that we worked in the same, and he's just a pumpkin. He's just a sweetie, and he's down to earth, and he never, not one time, acted like I'm above you because I'm an almighty doctor. He never did that. Never. And I wouldn't tolerate it if he did. He's a sweetheart. And, you all have to, it is your decision. Your decision. Let me repeat that. This is your decision whether you want to put up with this doctor or not. If they don't respect you and they're being a fool right out the gate, ditch them. Ditch them. You pay, your insurance covers their salary, or you pay out of pocket, or whatever the case may be. But when you hire someone, listen carefully, when you hire someone and they can't get the job done correctly, they need to be fired. It's just that simple. I don't care if you graduated from Harvard, magna cum laude. I don't care if you're an astronaut and you work with NASA and you invented things and you're a multi-gazillionaire. I don't give a rat's ass, or you're a cashier at a store. I don't give a damn who you are. Act like you got some damn sense, or you can be fired. That's it. Okay? You're the boss. You're the employer. They're the employee. You are hiring them to provide a service. So don't you dare get scared and nervous, and you don't want to say anything, and you don't want to address them being rude. At the same time, be careful, because if that person's going to be your surgeon, he doesn't really have to be your best friend, but he should have some kind of connection with you. If you're going to be slicing into my body, potentially, or giving me medication that affects my body, either way, we need to have some type of connection. We don't have to be best friends, We don't have to go out for a beer. I don't drink alcohol, but I'm just use that as an example. We don't have to go watch a football game together, but I need to have some kind of rapport with you, a professional rapport with you. If you can't even do that, you're out. Karate kick them in their money. That's the best way to hurt somebody. Karate kick them in their money, and they'll get a wake-up call. Now, will they change? Probably not. Maybe they will. I don't know. Depends on how bad they want that Jaguar, I guess. But do not be intimidated by your doctors. Don't. Or your nurse, for that matter. Don't put up with their shit. You're hiring them for a service. You are hiring them for a service. Let me say it one more time. You are hiring them for a service. If they cannot provide it in a professional manner, you're out. Period. End of story. All right? You guys take care. Don't be intimidated by these fools. They wake up like you do. They got to brush their teeth like you do. They got to use their bathroom just like you do. They got to wear deodorant just like you do. They put their pants on just like you do. So, no. We're not having it no more. Don't be afraid to speak up. And if you're, let's say, the person has an intimidating presence, okay? And you're scared to say anything, but you want to. What you need to do is take a deep breath. Take a deep breath. Think about what you want to say. And then say it. Don't be loud. Don't use bad words like I do. Okay. But say, I don't appreciate you making me wait for an hour. I didn't say anything because I'm caught up in the moment and I'm still absorbing everything. But I could have addressed him on that, but I was more concerned about my neck, to be quite honest with you. What are we going to do about my neck, okay? Because the pain's getting worse, right? But when I look back in retrospect, women, that's just the way we're wired. When we get out of the situation, especially, right? We look back and we analyze. We analyze the situation from all angles. That's just what we do. Okay. All right. I might not remember what I did yesterday, but I remember that you were disrespectful to me on a Tuesday at 3:00 when I had my appointment with you, or whatever the case is. I remember that. Women remember being treated like garbage. Okay. I don't think men deal with the disrespect like we do. I asked my guy friend, I could be wrong. I mean, and if there's any guys that are watching this, if you've been disrespected, by all means, please comment. I'd love to hear your experience. I asked my guy friend, I said, have you ever been disrespected? I'm sweating, I'm hot. Have you been disrespected by a doctor? He said, no. I don't think so. Anyway, speak your mind. And if you feel like you can't or you don't want to, get rid of them. Don't say another word to them. Just talk to your primary care and get another referral like I am. Because I'm not putting up with you. Period. End of story. I'm done. All right. You guys take care. Much love. Bye.